Yes.
Okay, excellent. Well, thank you so much for having me and joining this evening. I'm very excited to get to talk with you and give you an introduction to acupuncture for companion animals. There is a lot to discuss in this subject. So tonight's going to be focused on explaining introduction to it and give you some case examples. So as Dr. Dixon said, I live in North America. I live in the United States and in the state of North Carolina and Raleigh. This is Care First Animal Hospital. We're under construction right now, but I've been here for about 14 years. And about a year after joining, I had the opportunity to go back and learn acupuncture. And so, yes, I've been doing that with patients since about 2008, 2009. And here's a picture of my family. For my husband's support today. He has all the kids while I'm talking. So, like I said, my goals for tonight are to give you a basic understanding. What is acupuncture? Why does it work? When to consider it? And I have a few case examples at the end. So what is it? It is stimulating distinct anatomical points of the body to try to get the body to respond and react and start healing. And typically that involves using needles, which creates a little micro trauma. And I'll explain more on that in a moment. It is part of traditional Chinese medicine. So that whole part of traditional Chinese medicine has changed over many centuries. And the ancient Chinese did not do dissections of bodies to learn about them. It was more just based on observation and trial and error. And so some of the philosophy of why it works is really deeply rooted in those ancient thoughts. So I'm not going to go into that today. I'm going to stick with just the science of why, with modern medicine, we can explain why it works. So why to consider acupuncture? For me, my first exposure to it was when I was in college getting experience for vet school, and I was riding around with an equine veterinarian, an excellent doctor. And one day she said, "We're going to go to a farm and do acupuncture." And I remember sitting in her truck and pausing and thinking, that's strange. Like I didn't know what to think about it. I didn't know much about it. And what I had heard, I thought it was just a placebo effect. So we went to this farm and they brought out the horse, and the horse had a bad lameness. Then the veterinarian I was working with and a colleague of hers did acupuncture. And I watched the horse the whole time, and he extended his neck and he did the happy horse little lip blow and had this look of relief in his face. And then afterwards, they walked him around and his lameness was dramatically better. And I thought, something happened. That was interesting. Like I didn't see a effect happen. And then my next exposure to it was actually in vet school. I was on small animal surgical rotation, and there was a chow that came in. He could not walk with his back legs. They thought he had a herniated disc in his back. He was taken to surgery. Surgery was not successful. He was hot and febrile. He had a fever. We could not find a source for his fever. Blood cultures were negative. Blood work was no explanation for it. And he would not rest. He just was panting the whole time. And about 4 or 5 days after surgery, still was not improving and was in just tremendous pain. And the clinicians were talking about euthanasia. But the tricky thing was his owner was an elderly woman, and she said she did not see a reason to live if her dog was not going to live. So that made it very heavy of a decision. And so the clinician said, let's call in the acupuncture team. Maybe they can help. And at University of Florida, there is an integrated veterinary medicine team that does acupuncture with a resident. So the resident came in and she listened to the story and she said, "Oh, I think this can help. I see a pattern." And we all said, well, we're glad you see a pattern because we're stumped. And so she started needling the dog, and about 10 to 15 minutes into the appointment, he put his head down and he started to go to sleep. And I was shocked because that was the first time I had seen him sleep. And they had me check his temperature and it was normal. So he ended up going home with a wheelchair. And he was really the patient that changed my mind and said, like, this is something I want to learn about, because what we were doing was not working. And not only did it change his life, but it changed his owner's life too. So, but why should you consider acupuncture? I like it because it works directly with the patient to get the body to heal. It's very simple tools. The most simple is just using your hands. The most basic is pressure, which we'll talk about in a moment. But from that, it's just needles. And I have some right here to show you, if I can. They're these little tiny needles, and I have more on the next screen. They're cheap. I buy them in a box of 100 American currency. It's like $3 to $10 per box. Maybe Dr. Dixon can give you the cost in India, but very cheap. There are extra things that I do as well, which I'll explain in a moment, but those are optional. You don't have to do those. The most basic is just the cheap. It's also quite safe. There's not many reasons to avoid it, but there are just a few that I want to go through. So I never put needles in to areas of skin infection or skin cancer, because I don't want them to spread and I don't want them to worsen. I also don't do it for patients who have blood clotting disorders. Most of the time when I use needles, I don't get any bleeding at all. However, if I know a patient has a blood clotting disorder, I won't do needles. Also, if they are very, very, very low white blood cell count, very neutropenic, then I would think twice about needling them. Just as that needle could potentially introduce a bacteria, and I wouldn't want to do that. It can be tricky with patients who are very reactive, just very aware of the needles and kind of will respond, or aggressive patients. So I have some ways to get around that. I will try it. My first level is just trying to distract them. So I will use, have the owner bring in a food-filled toy. We have these red rubber toys called Kongs, and they'll put peanut butter or a treat inside, and just something for the dog to chew on and distract them. Another is putting a muzzle on them. And if the dog is pretty calm, especially when the muzzle is on, that option. I had one patient one time, and she would always try to bite me when I would go to take out the needles, not when I put them in, but when I would go to take them out. So I always just knew that we had to have a muzzle on her. I've also found it can be interesting with the owner being present or not present. Most of the time, I want the owners to be present. I find that their dogs calm down, they relax with the owner being in the room. But if the owner is very nervous about their dog potentially feeling pain, they will make their dog anxious. And if I sense that, I usually will do the first session with the owner present so they can know their dog is fine and isn't going to be hurt. But then after that, I schedule those patients for a drop-off appointment. And then I can get around, I can use injections, which I will explain all of this again in just a moment. Especially for those cats that have a very short window of patience, I'll do a series of injections on the cat. So the cat only has to be restrained one time and then let go of the cat. There's no needles to remove. Or most frequently now I do is a laser to stimulate the points. And again, more on that coming in a moment. Lastly, I don't do acupuncture for excitement-induced seizures. I had one dog like that early in my years of acupuncture, and he would get seizures every time he came to the clinic, which that defeated the purpose. And then you always use it with caution in animals that are pregnant, as it can induce labor. Sometimes that's wanted, but don't do it if it's not the right time. And I'm going to just check and see if there's any questions. Okay. So some more potential risks and side effects is just with the needles. You want to use needles that are sterile and new. You don't want to use dirty needles because you don't want to create infection. When I'm done putting in the needles, I write down which points I'm doing, and I go back and I find those needles and take them out. And then I feel the pet all over to make sure I got all of the needles out. I always tell their owner what to do. If they find a needle, just pull it out gently and, throw it away carefully. Sometimes the needle gets stuck when you go to take it out. I don't have this problem much anymore. I had that problem more in the beginning when I was still learning. But I found that if the pet just changes position, then I can get the needle. It's like the cutaneous muscle is kind of gripping the needle, and I just need the pet to move, and then it comes out easily. I did have one time a dog ate a needle, a very tiny needle. It was on his face, and he had a big tongue and just slurped it down. It was okay. I did feed him some cotton balls and with some chicken broth on it. And then we took x-rays to make sure the needle passed. It passed fine. But that is a potential. So I watch dogs carefully when I have needles on the face or when they're in, so they don't swallow any. Always be very careful with needling around eyes and on the face. And then, like I said, I think twice about it if an animal is pregnant. Most pets will feel tired with acupuncture because there's a serotonin release that happens. And I like to see that. I like to see that they get sleepy. That helps me to know that it's working. But if I have a patient who's very old and very weak, then I want to make sure I don't overdo it. And so I just will use fewer needle points. I don't use too many. So there's several techniques with acupuncture. The most basic is acupressure, and that is where you're just pushing on the point with like a firm pressure or a slow circular pressure. I think this is pretty common with in our world for people, like if you have a neck pain and you have those tight muscles, that's pretty much what you're doing at those trigger points when you're trying to get that muscle to release. Also, if you can see on the side of the screen, hopefully my window isn't blocking it. The C bands, those are bands for motion sickness. And so those will press on a point on the inside of the wrist. It's called PC6. That helps with nausea. And then for dogs, actually the muzzle straps going behind the ears is a form of acupressure. It pushes against on-shin, which is a point that helps to calm and relax patients. The next technique is actually needling. So this is, I think of most of the time when I think of acupuncture. I choose the points that I'm going to needle based on the dog's or the cat's diagnosis. And then I place the needles and I leave them in for about 20 to 30 minutes, and then I remove them. These are very thin needles. So if you look in that picture, that is the syringe and needle is what we typically use at work for vaccines, or it is what we use for work for vaccines. It's a 22 gauge needle. And then the needles above it are my acupuncture needles. So the most top tiny needle, that is called a hand needle. And I use that on very tiny dogs, small cats, on their feet where it's going to be more sensitive, on their face. The next size, that middle needle, I will use for pretty much all dogs and cats as well, more on their body. And then the larger needle I use only for large dogs, usually on their back and kind of the back muscles where it's thicker or where they have more fat tissue. So they come in these sterile packs, and usually of either 5 needles in a package or a single needle in these little blister packages right here that you peel down. When you take them out of the package, there is a tube and a little plastic tip that just holds the needle in place. And if you want to look in the actual video, I can demonstrate and show you. So I have an orange. And so what I do is I put, trying to get this where it can see it. I put the tube against the patient's skin, and then I just do a quick little pop, and then I put the needle in, and then I'll usually do a gentle twisting motion or a little flick to get the needle to stimulate the point. But usually I'm doing a gentle twisting motion. So typically they, like I said, they don't bleed, and most pets tolerate them very well. Occasionally there will be a sensitive place, and if it's painful, I just take the needle back out. So the next technique, and let me just check to make sure there weren't questions, is electroacupuncture. And this is where connecting an electric current to the needles. And so let me demonstrate too. I've got my wire right here, my orange again. Here's my little clamp on my wire, and I'll just connect it onto the wire. And usually for the pet, I will go low down, and I'll actually clip it onto some hair as well to help hold it on the veterinary patients. It is great for disc disease. So really it's good for neurologic diseases or severe pain or muscle spasms. That's when I use it. I will also use it if it's a pet that I know I'm not going to be able to see very often, because it helps the endorphins circulate longer in the body. So I wouldn't have to see the pet so frequently. The intermittent low frequencies are very good for helping motor neurons communicate and kind of relearn to communicate with each other. So for paresis and paralysis conditions. And then the continuous high frequencies, 80 to 120 hertz, help to release the endorphin. Those are enkephalins, and for pain and muscle spasms. There's one caution with this, and that's that when you hook it up, each wire has 2 clamps that you're connecting 2 points. And so I never do this from like the left forearm to the right forearm, or where I'm crossing over the area of the heart. Technically, you're not supposed to use it with patients with defibrillators. I've never had a patient with a defibrillator, so they're not very common for us, but in the literature, that's a no-no. The next technique is moxibustion. So this is where you're actually applying heat to acupuncture points or to the actual needles themselves. It's there's 2 sticks that are pictured. I have them right here with me as well. There's your traditional moxa. It's from a plant called mugwort, and it's really bad. It's kind of a skunky smell, and it smokes a lot. I don't use this in clinic just because it's too smelly. And I also, if any of the pet owners or the workers in the clinic have respiratory infections, it's a lot of smoke to have in a small indoor space. But it does work very well for cattle and horses outside, like in a barn situation. You can do that one. That's more large animal. I use smokeless moxa. It's smaller. It does take a lot longer to heat up with a flame, but it doesn't smell very bad, and it doesn't produce so much smoke. But both of these get very, very hot. So you never touch it directly to the skin of the patient. It will burn them. And actually, if you get close to the hair, you'll actually hear the little singe of the fur. So I just hold this to the point. So again, here's my orange with the needle. So what I will do is I'll hold the needle with my fingertips and touch the tip of the moxa that's on fire, that's burning. I'll actually touch it to the tip of the needle, and I'll just hold it there for a few seconds until I can feel the needle warming up, and then I go to the next point, and I will go through all the needles that I want to do on the pet, and then I'll come back about 2 or 3 times because I'm only holding it there for like a second or two each time. I love for my cold, arthritic, painful dogs, especially in the wintertime, when they're just achy and stiff. This really helps to kind of warm them up. And it's also something that I can teach the owners to do at home. Just I'll show them where on the body I want them to do it. They can put their hand there and hold the moxa a couple inches above, just start to feel their finger warming up, and then they move to the next spot. I see there's a question. Let me see what this is. Oh, can you use, so the question is, can we use anything other than these sticks to heat up the needles? That is a great question. I am not aware of else being used, but I can research that and I can let Dr. Dixon know. I'm not sure. I've only ever used moxa. Hold on just a second. There we go. So another technique is doing injections, and typically I'll just use saline. That's most commonly what I use. I don't do these injections very often. I would say maybe only once a year, but occasionally I feel like it's the right choice. And sometimes I'll use a 50-50 solution of saline and vitamin B12. The reason for vitamin B12 is that it's considered to be nourishing to the nerves. So that's the reasoning. And I use 0.1 to 0.2 milliliters at each point. You do have to change your needles. And so I will choose either the smallest is needle at the clinic, like injection needle that I have, which is a 25 gauge for us. Or I have used insulin syringes for this before, excuse me, where I will fill the insulin syringe and I'll just use several insulin syringes during the time. I'll just use the needle for only 2, sometimes 3 spots, but I try not to do any more than that because it will get blunt. And like I said, the times that I've used this is when I have a cat who I know I can restrain at first, but then they start to lose their patience. So I'll do the points that I want to. That little fluid creates pressure at that site, a little fluid bleb that then as it's absorbed, it stimulates the point as well. And then the needle going in for that injection also creates the micro trauma, which we'll get into in just a moment. Laser therapy this is what I do a lot for the pets at work who are too painful or too wiggly to keep needles in. And what I use is just, there's actually that in the picture, there's a small head, and that's what I use for this cold laser. It's a therapeutic cold laser. And our machine actually has an acupuncture setting. There are other machines that'll have a fine tip point that you can do. And then I have heard that there's a small handheld laser device. I know there's an exotic veterinarian in Raleigh who does acupuncture for her, the little tiny pocket pets that she sees. And so she uses the little handheld laser. So for me, to kind of summarize, I like an integrated approach. I consider there to be many tools in our tool bag that we can pull from. The main tool being a good physical exam. And then if blood work is warranted or imaging, then we do those. Modifying food, modifying living conditions at home. I will prescribe medications that I think are appropriate for the pets. But then I also consider acupuncture. I'm not just a one person. I like bringing all of these together to benefit what is the best plan for the actual pet. So what is happening in the body? The thing I want you to remember from this is nervous system, immune and endocrine systems, and the vascular system. Some things that we talk about will make sense and some things will not make sense. And I think that's okay to know in the beginning. And it's important to know that. Like I said, the modern medicine helps us understand the science behind acupuncture and why it works and the cellular reactions. Many of the points follow the nerves. And I think that we can already understand that there are connections in the body that maybe we don't fully understand. And I think a big example of that is referred pain, like with people when we're having a heart attack. And men will have that left-sided arm pain. Women sometimes will have this neck pain that'll happen with referred pain. But some aspects are not going to make sense. And I'm okay with that. I always think about anesthesia and how anesthesia is a bit of a mystery. It was a trick question always on the veterinary exams at our school of why does it work? So we know some mechanisms of action, but some we don't. Anesthesia is really important when we use it. To me, the body is complex. I think it's intricately designed, and we know some of the communication and some of them we don't understand. The other thing that can make acupuncture tricky for people to want to try is the vocabulary is hard. It reflects that Chinese heritage. So I think when it's being described, it can be confusing to people. And I think sometimes we're scared of what we don't understand. And then and especially with people, there's the skepticism of, is there a placebo effect? And I certainly think that can happen with people. With animals, though, I think there's less placebo effect. I've been pretty convinced by this because I'll see a dog who's usually scared to come into the vet clinic, but will come in for acupuncture and feels better. So I think it's less so in veterinary medicine. I want to explain two terms, and then we're going to come back to the science of why it's working. So the first term I want to explain is acupoints, and these are those very specific anatomical points that I work with. They have names. When I was in training for acupuncture, I had to memorize about 125 points, but there are about 360 points that are documented on the body. I would say on an average day, I probably am working with 50 of those points. The others I'm looking up for special cases that I don't see very often. But the common things, I use common points. And those are the ones that are responsible for the local effects of acupuncture. These are areas that are considered neurovascular bundles. So they have lots of free nerve endings. They have muscle tendon sensory receptors. So Golgi tendon, organs, and then those muscle spindles. They have areas of immune cells, clusters, so mast cells on people. If you have fair skin, you may actually see a red spot develop from the histamine from the mast cells. And then there's also areas of small blood vessels, so arterioles, venules, lymphatics. These points happen in areas where the nerves are traveling through bone, through muscle, or through fascia layers. It's also often in areas where the nerves are branching out or they're joining back in to go into the spinal cord. Like I already said, you can stimulate these points by deep pressure, micro trauma with the needle, heat, electricity, or photon, that's the laser. They are areas of low electrical resistance and high electrical conductance of the skin. And there's also been research that there's more calcium ions at these places than in surrounding tissue. So here's a picture of an acupoint. I will say the hand, I think, is very small compared to the giant needle in this picture, but it was the best representation I could find. There is, at the top, you have your dermis, your skin. Right underneath the skin, you have free nerve endings. And all of these cutaneous afferent nerves are bringing those information down and then joining into the main nerve and its branches. You have areas of blood vessels And in here, you also have those immune cells. And then down here in the muscle, you have those muscle spindles. Those are those sensory fibers. Like I said, how some parts will make sense. These are kind of we call these the association points, like your main points that you're going to work with internal organs. And so there's a liver point, gallbladder point, spleen, lungs, and hearts. And this makes sense to me because when I look at the anatomy of the animal, you have areas where those nerve roots are leaving the spinal cord and going down to those organs. That makes sense to be an important point. Also, here's a picture of the anatomy of the pelvic limb of a dog. So on the left, you have the bone and the muscles. And on the right, there's a diagram of where these acupuncture points are. And GB29, BL54, and GB30 are some of the main points that I use for hip arthritis. And if you come over to this other picture, they fall right in this area. And it makes sense to me when I see the anatomy of why those points, I would be working with the nervous system in that area. So acupoints are the local points. They're specific and they're named. The other important term to know is meridian. A meridian is a line of acupuncture points that are believed to be in communication with each other. And they are associated with specific organs, internal organs, and believe that you can actually make an effect to that organ by needling that point. So again, kind of that idea, similar to referred pain and why that works. This is the connection of the different points. So I like to think of this as a highway. So the meridians are the highway, and the acupoints are like the towns along the highway. And there are 12 regular channels. They're called regular channels, and there's 8 special channels. And I see we have a question. Question is, how can someone be sure about the position of acupoints given every dog has different conformation? That is an excellent question. So one is, there is actually a book that I use. I can type it in a moment. It's Shay's Veterinary Acupuncture, and it has all the points listed with the anatomy of it. We also have in there how deep to put the needle. And then to quote Dr. Shay, who's the teacher that I learned under, he said, "You make it your best guess." And as I'm going to explain, there's that neural axis. And so even triggering kind of part of it, you can, if you're close enough, you can stimulate the point. You want to be as close as possible to get the best effect, but even being just close to it, you can get a response. But to answer your question, it's really just memorizing the anatomy and feeling the pets and knowing where you should be needling and just trying your best. So with the meridians, I do find this is the confusing part for a lot of people. The vocabulary here can stump us. Remember that a lot of the history of acupuncture is, again, rooted in the ancient Chinese culture. And so this, for me, is just memorizing. I think of it as learning a new language, how there are going to be idioms when you learn a new language. Those are those phrases that don't directly translate. And so I say, don't overthink it. It is important to know the name of the meridian because that's the organ you're working with, but it's also memorizing. So there are 12 regular channels. These are bilaterally symmetrical. So there's the same ones on the left side of the body as there is on the right side of the body. They are named for their associated internal organ. So lung, spleen, heart, kidney, pericardium, and liver. It's kind of interesting that pericardium is considered an organ. It just is. And these are considered kind of your baseline organs that that are needed when the body is resting or at the state of yin. So cooling, resting. There are also 6 that are more the hardworking, churning, hot. You need heat for these to work. Energy. Large intestine, stomach, small intestine, urinary bladder, gallbladder, triple heater. And you're going to say, I never learned about something called triple heater in vet school. And you're right. It is like its own organ system. I think of it as the furnace of the body, that metabolism that gets the body warmed up and going. Again, that reflects the Chinese heritage. It's just something to memorize. There are also 8 special channels. These are not associated with an organ system. Governing vessel is, or we call it GV, runs along the dorsal midline of the pet. And then conception vessel runs along the ventral midline. There are also 6 other channels. They just borrow points from the previous channels I've already mentioned. Really, they're for this conscious proprioception. So that nerve ability to know where you are in space, and then coordination, balance, and motility. Very complex neural and cellular connections between body regions. And with this is this idea of homeostasis. Homeostasis is when a body is functioning appropriately and everything is in balance. And the Chinese have this idea of there should be rhythms throughout the day. And when these rhythms are disrupted and the body's no longer in homeostasis, then it's vulnerable to disease. And with that is this idea of qi. And qi is like, I think of it as oxygen or blood, kind of metabolism, like that movement throughout the body. And some of it, like I said, makes sense. Some of it doesn't. But I do know that blood gets pumped through the body and we breathe and move oxygen. So I'm okay with just accepting that. It's a very different way of thinking about body connections than we were taught in vet school. So here's an example of meridians running down from the head down to the forelimb of a dog. Large intestine is LI, triple heater is TH, small intestine is SI, and heart is HT. And then here are some along the back of a dog. And I would say this midline I use a lot. And then also the one just to the side of it is the bladder meridian. And I use that meridian a lot as well. And you can see this is one of my patients, Hank. Hopefully I'll get to talk with him about him at the end. He is a basset hound with urinary issues. So I was using a lot of the points from the bladder meridian on his back. So why does it work? There is no single mechanism of action to explain it. It's really that the cellular effects begin locally and then they expand to involve the entire neural axis. Also, this idea of a tiny little bit of trauma triggers the body to respond and start healing. And which points you stimulate and how you stimulate them influences the response that you will see. So multiple mechanisms of action have been suggested, and I want to just briefly go through those. So the coagulation cascade, this is that part of our body that is always working to detect any foreign material and any trauma and respond and clot the blood. So you get the needle prick, you get a local microtrauma, you get Hageman's tissue factor 12 released, and then that's the whole trigger of that big cascade. But the end result is that you actually have more blood flow to the area, and dilation of those blood vessels, increased local immune response, and then ultimately a relaxing of the surrounding muscle and tissue. The pain pathway is also really important to understand. And so if you remember from your veterinary training, there are 4 types of fibers. So the A, delta, and the C fibers are responsible for pain. The A delta are coated, so they're myelinated. They are really fast. They cross over to the other side of the spinal cord and they shoot way up, going to the brain to send that pain response. The C fibers are slow. They stay on the same side of the spinal cord. They are not coated. They're not myelinated. They take their time getting on up. And those are worst pain. That's that deep throb that happens after you've hurt yourself. The other two fibers, those are the A alpha and the A beta. These are more for touch and proprioception. And so there have been studies that acupuncture points can stimulate all four types of those fibers. And with this is the idea of gate theory. The gate theory is that the spinal cord actually has little inner neurons that can either allow pain to go to the brain or block pain. And that the touch nerve fibers are the ones that are responsible for blocking nerve pain. And a classic example of this is, you hit your thumb with a hammer and your immediate response is to suck on your thumb or to rub your thumb, or you hit your knee on a corner and then you stop and you start rubbing. You're doing like a deep pressure or rubbing sensation to get all those little sensory touch fibers to actually go to the spinal cord and block the pain. And acupuncture works similarly. I'm using very, very, very tiny needles just to stimulate those, get the pressure nerve endings firing so they can go to the spinal cord and block the pain. And that's one of the reasons why I really love this for my geriatric patients who have pain issues with arthritis, is I can actually block some of that deep throb of the arthritis. And there's a question. The question is it advisable to use sedatives in aggressive animals during acupuncture therapy? That's a great question. And based on what's going on with the brain and the spinal cord, they actually think no, that you are going to be sedating the nervous system. And so you're not going to be getting the neurotransmitter release that you would want. So if you can avoid doing a sedative, it's better to not do a sedative. There are also prednisone is a medication we commonly use. It can actually suppress some of the response of acupuncture as well, because it's the anti-inflammatory. So similarly with these pathways, I try not to do sedatives at all if I can. Great question. So endorphins and neurotransmitters, with that pain pathway, you can get endogenous opioids being released. And there's several places that will do that. The hypothalamus in the brain and the segmental interneurons in the spinal cord will release those endorphins. And they will actually, I'm going to go back a slide. Right here at these little synapses, there are receptors for endorphins, and those will bind to those receptors and will actually kind of work on that gate to close the gate. It also, the hypothalamus releases ACTH, so adrenocorticotropic hormone, and that signals release of cortisol, so you get that anti-inflammatory response. And then there are three: serotonin, dopamine, and norepinephrine that are released. And these also work in the central pain pathways. And one of them really suppresses substance P. And that substance P is that neurotransmitter that is responsible for pain. So if you have less substance P, you're going to have less pain being transmitted. The pituitary gland also gets activated to release beta endorphins. And then there's many others that I didn't put in the slide, but GABA, I know that's one that we talk about a lot here in the United States with using gabapentin for nerve pain issues. So GABA is that happy, feel-good neurotransmitter, and that also gets released in this process. And then also at the cellular level, when you put the needle in, and I'm doing that gentle twisting, turning motion, it is actually pulling on collagen fibrils. that then pull on the associated fibroblasts. And that actually triggers on a cellular level a remodeling, and changes with some of the gene upregulation for forming the tissue right there. And so the end result is that it actually relaxes. And it's similar with the idea of massage therapy and why massaging helps loosen those muscles. It's the pressure, but you're also kind of getting a restructuring of the actual collagen fibrils in this process. And that that effect can last for hours to days. So the question is, isn't the needle too smooth to pull on any collagen fibers? So I do use very small needles. That is an excellent question. If you're wanting more of a response, you would use a larger needle and trying to get motion with that. But that's also a really good point. I'll have to look into that and find out a little bit more on that. That's an excellent point. I don't totally know the answer to that. So given how it works, when do I use it? My main time that I use it is with orthopedic disease. So arthritis, post-operative surgery recoveries for dogs. These would be patella surgeries, other knee surgeries such as the where you have the tear of your cruciate ligaments, or with hip surgeries. Neurologic diseases, it is used with seizures. I haven't done a lot with patients with seizures. And the one exception, especially with that, is excitement-induced epilepsy. I don't do it with that. Nerve palsies, I have done that. I had a cat patient one time who had a trauma. She was stuck in a tree for about 12 to 24 hours, and she had a femoral nerve palsy. And so we did acupuncture and she was able to regain function. It is an option to manage degenerative myelopathy. Typically, that's just a degenerative disease. There's no cure for it, but acupuncture can help to kind of help with the symptoms that the pet is experiencing and to kind of delay its progression. And then laryngeal paralysis, it is used for helping to manage laryngeal paralysis. Intervertebral disc disease, I put that separately since that's kind of a combination of orthopedic and nerve disease. It can be used acutely. So if I have a dog in the hospital, usually it's one of my coworkers' patients, and it's really painful. They'll have me go ahead and do acupuncture on the dog while it's in the clinic. And it can be used chronically for dogs who have chronic intervertebral disc disease. I like it because I can actually target the points before and after where I know the disc is herniated. So it's almost preventative and decreasing the inflammation at those areas, since we know that disc disease tends to cascade up and down the spine in multiple places. So I really love it for disc disease. I do see it patients quite often that'll come in for arthritis who also have elevated kidney or liver values on blood work. And so their veterinarian is hesitant to prescribe a non-steroidal anti-inflammatory for their arthritis pain. And I like acupuncture because I can kind of get those end results of the NSAIDs without having the side effects of the NSAIDs. Urinary incontinence, and then constipation and megacolon. You can get the gut kind of moving and working with acupuncture. Emergency care, there is a point on the tip of the tail that if you needle, when you have a dog that comes in with really hot, like 105 temperature, if you just take your tiniest vaccine needle, your 25 gauge needle, and you just put it right into the very tip of the tail and get a blood drop or two and then take it out, that can help to lower the pet's temperature. There is also a point on the nose, right in between the nostrils, that if you press really hard, for like a neonate that is born and not breathing, it will trigger a breath response. That's a really handy point to know, especially when doing C-sections with dogs or cats. And then I haven't used it much for this at all, but I know that there are large animal vets who will be in this talk. There is use for it with labor induction and uterine prolapse and metritis and also vaginitis. I am not super familiar with those points just because most of my patients have been spayed or neutered. And so I don't get much experience to practice that. But it is, you can work with the uterus. And so those are points that are commonly used in large animal medicine. So here's a case. So this is Sam. He is one of my patients right now that I'm actively seeing. He is 10 years old and neutered. He has been painful getting up and getting down, and he has pretty severe spinal spondylosis in his back. Oh, I'm running out of time. Okay, I'll just do this one case and then we'll wrap up. He has arthritis in his hips, and he has horrible arthritis in the base of his tail. Like I can hardly get his tail to move at all. It's just crunchy. You can feel the arthritis in it. He has trouble posturing to defecate, and he's also has trouble passing his stool. I'm not surprised because he can't raise his tail much. His owner has noticed that he doesn't wag his tail very often anymore. He has muscle atrophy in his rear legs. As you can see, he's wearing a diaper. He has urinary incontinence, and he had a negative genetic test for degenerative myelopathy. He is on multiple medications. His owner is actually a veterinarian at the University Hospital near us, and he's a patient there. So he has been on a non-steroidal anti-inflammatories, so gabapentin, glucosamine chondroitin for joint support, amlodipine for they made Proin, so phenylpropanolamine for urinary incontinence, but his blood pressure spiked, and so they had to take him off of that. And then recently they tried a testosterone injection, and the owner hasn't seen any changes with his urinary incontinence. And so when I see a consult, what I start with is I do a complete physical exam. I will run my fingers along the meridian, especially the back meridians, looking for places of depressions at acupuncture points or sensitive areas. So the muscle, see if the muscle twitches or if the pet turns their head when I'm touching on different places. I ask a lot of questions to the owner. I want to know about their appetite, their GI symptoms. Are they seeking cool places in the house, or are they always trying to warm themselves? Do they seem stiff? And does it seem any different in different seasons? And all of that is trying to give me a picture of what's going on, going into what we didn't get into today, which is the kind of Chinese philosophy, but looking for patterns, similar to what that resident did with the chow when I was in vet school, the paralyzed chow, and how she listened to everything. And then she said, oh, this makes sense. It's a pattern. There are these patterns that you look for. And then I always ask the owner, what are you concerned about? What is your goal? And I think to myself, is this goal reasonable? So for this owner, she said, I'm expecting a baby. I really want my dog and my baby to get to meet. And so I want him to be comfortable. I want good quality of life. And I don't want to say goodbye to him yet. Like, he still mentally seems spry and happy. I just want to have a better quality of life, which I'm like, I can work with that. That's a reasonable goal. If she said, I want my dog to be able to move his tail like a puppy again and be, energetic like a puppy, then that would be a different conversation of, well, I don't know if I can help with that. So I always find that out. And then, like I said, the owner's goals. And so the plan is I try to start them. I do that session, the first session that day, and then I try to see them 1 week later. And I will see them once a week for about 2 to 3 sessions until we start seeing some signs of improvement. And then I start spacing the appointments out, because what I want is those endorphins to start circulating in the body and lasting a little bit longer and a little bit longer and a little bit longer. And so the points for him that I chose were spinal points, hip points, urinary points, and constipation points. And I'm going to probably end on this. I want to teach you some points too for cases like this. So if you look in the upper right picture, this is actually, see, I'm pressing on those 3 points that I mentioned earlier in the slide. So GB29, bladder 54, and gallbladder 30. These kind of cup the head of the femur. So I always palpate the dog. I find the actually where the hip is, which can be tricky. If you have a really fat, overweight dog, you may think the hip is in a different area until you move its leg and you realize, no, the hip is actually lower than I was thinking it would be. So I find those points and I put in the needles at those points. Where the red dot is a point called Jianjiao, and that one is really excellent for lower back pain and hip pain as well. And then on the actual rear end of the animal, if you raise the tail, there's a little pocket that'll form right under the base of the tail. And that point I needle, it's above the anus. I do use the tiny needles and I'm very careful. And I always try to make sure I remove that one and don't forget about it because it's out of sight, out of mind. But it is excellent for dogs who have, they're dropping stool at home, or they are so painful that they're becoming constipated. Any types of constipation cases, this one can be helpful for. And then likewise on the top side on the dorsal aspect of the tail, when you raise that tail, you also get a little pocket. At that point also works really well for tail pain, any kind of tail pain or limp tail. You can use that point as well. And then I have another case. I'll leave it in the slide presentation and you guys can read about it, but I believe we're at time. Is that correct, Dr. Dixon?
Please carry on, Dr. Alison.
Should I continue or should I stop?
Yeah.
I think.
Yeah, please continue, Tricia. Yeah.
Continue. Okay. So I have one more case. So this is Hank. He's also one of my current patients. He is a 7-year-old male neutered basset hound, and he was rescued about a year ago. He was very sickly when he was rescued. He was heartworm positive, and he had a bad skin infection. He had ear infections. And after they had him for a while, he started dribbling urine. And they wondered, was it more that his bladder was kind of flaccid and not holding well? He had a full workup, labs, urine culture, ultrasound. He had a test for bladder cancer. Couldn't figure out, his test was negative. Didn't really have a reason for him to be dribbling. He was on bethanechol and carprofen, and they tried phenylpropanolamine, and he didn't have any response to that. And I think he's an interesting case because he's a case where if we're just doing, Western veterinary medicine, we kind of run out of options. It doesn't quite make sense and we don't have an answer. And so the owner is then left with needing to use either a diaper or kind of modifying at home. He is an indoor dog, so this is an issue for him. He would kind of be forced to look at being an outside dog. But with acupuncture, it is a pattern. And that pattern is a syndrome called Lin syndrome in Chinese medicine. And so I chose points for strengthening bladder sphincter tone and to help with being able to pass urine. And he improved. And so I saw him weekly, and then I saw him every other week. And now I only see him like every 2 to 4 months. When the owner starts seeing that he's starting to dribble urine again, then she'll schedule him and he comes in. And which is typical for pets with acupuncture. Is usually, if it's a chronic issue, if it's acute, I'll probably only see them 3 times and then we're done. Like the cat that was stuck in the tree that time, I think I only saw her 2 times and then we were done. But for Hank, he has a chronic issue, probably every 4 months going forward. So let me see, there was a question. Oh, okay, it wasn't a question. So I think that's everything I have for you all. Let's see. Yeah, anybody have any additional questions tonight?
Excuse me,
Yes.
what's the recovery of in the acupuncture? The recovery rate?
The recovery rate? So I would say for arthritis, I would say probably 90% of my patients, the owners see improvement. And for disc disease, I would also say it's probably about that. The times that I have had patients with a disc issue that were really painful, that were not responding at all, or who were getting worse, ended up having a spinal cord tumor or some type of a cancer. And so that's usually a sign. I tell owners to try 3 times. If they don't see a response within 3 times, either acupuncture isn't the right response, right treatment, or I'm not the right person to do it. They could try somebody else. If it's a really old dog, and I think seems straightforward, they should respond really well, and they're not, and they're getting worse, then I start talking to them about, let's look, or have your primary veterinarian look for cancer, because usually there's something else going on that isn't. I would say I know that there are veterinarians who use it for allergies and kind of more obscure things. I think the success rate with those are less than with the musculoskeletal and the nerve issues. The nerve issues and the musculoskeletal issues, pretty high rate. I don't have a specific number to give you, but
And
I
how
hope
about
that
the
helps.
response in case of carcinoma and all?
For carcinomas,
Uh,
did I?
do you treat with the acupuncture?
For carcinomas,
Yes, carcinomas, sarcomas, some.
I don't in those areas, no. I won't. I will do acupuncture for dogs with cancer who have more of like an internal cancer, or I always have to tell their owners, if they do have a skin cancer, like, I'm not going to go in that area of the cancer, but I have no guarantee there aren't other areas that could have cancer cells that I could spread. So I tend to not use them for carcinomas and squamous cell carcinomas.
And one more question.
Yes.
Suppose if he misplacedly pricks the needle with some other points, will it have some adverse effect?
So you might be stimulating points that you don't want to. Let me think about an example of this. I don't think so that they're going to get worse, but they might not get better. Like, if you're wanting to do, like, when I do dogs that have arthritis, I do points across their body, and I choose the points carefully, which ones I want to do. I might be stimulating stuff, though, that helps with lungs or with large intestines, but usually there's not a negative side effect to that. You can do problems if you do too deep, or you just won't get any benefit if you're just doing areas where there aren't acupuncture points, like close to acupuncture points. I hope that helps. I don't know if I answered your question.
Thank you so much.
You're welcome. So there was a question. Let me go back. So there was a question. Can we use acupuncture as a standalone therapy, or do we always have to use it as an adjunctive treatment? Yes, you can use it as a standalone therapy. There are practitioners who do that. I do integrated. I combine it with what I've learned in vet school as well, because I feel like there are so options to choose for patients between medications and acupuncture, and I want to choose a plan that's best for the patient. But I do know of practitioners who only do acupuncture. And so there are people who do that. And the question is there a risk of any catastrophic failure even after the therapist is cautious? Yes, so if you have a very feeble, kind of close to death animal and you do too many points, you can risk them dying. I heard it once explained, it's like they almost get that energy boost to then pass away. So I don't do a ton of points I use only a few points on the older, more sickly patients. And I always warn the owners that they might look worse for 48 hours after acupuncture. And don't be worried if they see some worsening of symptoms before they start getting better. Let me see. Also, so you wouldn't, I think trying to think about any other scenarios. That's really the only catastrophic one I can think of. And then making sure you use clean needles, that you're not using dirty needles to create infection. The one question is, where exactly do you insert the needle for urinary incontinence? So I do several points. So I do the points on the lower back. There's one called bladder 26 and bladder 28. Those are very helpful for urinary function. And if you think about the body of a dog, it's kind of where the nerve roots exit the spinal cord to go down to the urinary bladder. There's also several points on the ventral midline. That's on that conception vessel meridian. And 3, 4, and 6 are CV3, 4, and 6 are points that I use. And so I will kind of spread my fingers between the pelvic bone of the dog, and I find its umbilicus, and I spread my fingers, and then towards the pelvic bone, my third and my middle 2 fingers are where I needle on the belly of the dog. And then there's also right below the anus, there's a point called CV1 that can be really helpful for urinary incontinence as well. Are there any other questions?
In dogs, dermatitis is a great problem. Will the acupuncture be effective? Will be of help?
Can you repeat the beginning? The dogs with which condition?
For usually there is lot of problem with the skin. That is, dermatitis is a problem in dogs.
Okay.
Will this acupuncture will be effective in the dermatitis cases?
As long as there's not like pus, you wouldn't want to use it if there's a pus. There is a point on, like, let me find a picture in my book real quick. Skeleton of a dog. Right on, I don't know if I can get this to show up in the video. Here, let me. I don't know if this is going to show up. Right here on the base of the neck of a dog.
Yes.
Like if you go to raise up his neck and lower down his neck, right on that midline point, right where that kind of junction is, you can needle there, and that will help to reduce kind of heat and inflammation of the skin. That is a good point. There is a point for skin itching that I can look up. I can email it to Dr. Dixon. I'm trying to remember that point. That's not one that I commonly use. But there are some points for skin itching. But the big thing is being careful with infection. But I can look this up, and I can have more information on this in my next talk that I'm going to do, if you like.
Thank you so much.